The sphenoid bone, or os sphenoidale, is part of the base of the skull and thus closes the cavity of the neurocranium from inferior. It has 4 parts, but not all of them are visible from the endobase. It has corpus ossis sphenoidalis, the body of the sphenoid. It has ala minor, the lesser wing, ala major, the greater wing, and it has also processus pterygoideus, which is visible only from the outside. Now, corpus ossis sphenoidalis is a cube-like structure. It's in the midline. Inside it contains the sinus sphenoidalis, the cavity, and it has then 6 surfaces. The superior surface, visible here with a depression called sella turcica or fossa hypophysealis. Its 2 lateral sides to the left and right, and also it has this posterior side that is contacted by the pars basilaris ossis occipitalis, which creates with the body of the sphenoid the so-called synchondrosis sphenoccipitalis. The ala minor, the lesser wing, is connected to the body by 2 roots to the upper superior and anterior angle of the body, and between the 2 roots we have a tunnel which we call canalis opticus for the communication with the orbit. The lesser wing continues anteriorly into the pars orbitalis of the frontal bone, and its posterior margin is free, clear. The greater wing attaches to the body of the sphenoid inferiorly and anteriorly, and it creates the floor, partially the floor of the middle cranial fossa or fossa crani media. Together with the lesser wing, it creates a fissure-like opening, fissura orbitalis superior, for another communication with the orbit. The greater wing has contacts with the pars petrosa of the temporal bone, the petrous part of the temporal bone, and it has a long contact with the pars squamosa of the temporal bone, or squama temporalis as well. The greater wing has several surfaces, most of which are visible only from the outside. The only surface visible here is the endocranial or cerebral surface. From the exocranial view, the sphenoid bone has the following parts. Corpus ossis sphenoidalis, the body of the sphenoid that continues posteriorly in the pars basilaris ossis occipitalis, and anteriorly it attaches the vomer, which is part of the posterior bony nasal septum. Then to the sides we have the 2 pterygoid processes, processus pterygoideus, with 2 plates, lamina medialis and lamina lateralis. And to the side we have the ala major, or the greater wing, which has 5 margins and 5 surfaces. These are usually named based on the contact or the area they face. So in this regard we have margo petrosus, contacting pars petrosa of the temporal bone. We have margo squamosus all the way up here, margo squamosus contacting the squama temporalis. We have margo parietalis for the parietal bone. We have margo frontalis contacting the frontal bone, and we have margo zygomaticus contacting the zygomatic bone. Then the surfaces are as follows. This area here is called fossa temporalis on the articulated skull, so the name of the surface is facies temporalis. Underneath the temporal fossa, we have the infratemporal fossa right here, fossa infratemporalis, so the name of the surface will be facies infratemporalis. Then a difficult to see surface is right at the tip of my pointer. It's right there inside. This is called facies maxillaris or senomaxillaris, and it is facing the maxilla, and this is why we call that facies maxillaris. And then we have the facies orbitalis, the orbital surface that creates part of the lateral wall of the orbit. And the last surface obviously will be the intracranial surface or facies cerebralis. On the isolated model of the sphenoid bone, or os sphenoidale, we can see all the details of the bone. It has a This is the posterior view of the bone, posterior superior view of the bone, and this is the anterior view of the bone. It resembles a butterfly with wings and legs and a body. We're going to first start the details, discussing the details from the superior posterior view. For reference, here's the skull and the position of the bone within the skull. Now, the bone, sphenoidale, has a body which has 6 surfaces, cube-shaped body with 6 surfaces. The superior surface has sella turcica in the middle, or fossa hypophysealis for the hypophysis. Posteriorly, this sella is bordered by dorsum sellae, and the 2 sides of dorsum are called processus clinoideus posterior. Anteriorly, the sella is bordered by tuberculum sellae, and in front of that we have the transversally running sulcus prechiasmatis, which holds the chiasma opticum. Now, the posterior surface of the body is practically fused to the base of the occipital bone. Anteriorly, we have the anterior surface of the body, which in the midline has this crest, crista sphenoidalis, that is part of the nasal septum, and on the 2 sides of the crest we have the 2 openings for the sphenoidal sinuses, apertura sinus sphenoidalis. On the inferior surface we see a small protrusion which we call rostrum sphenoidale. This rostrum sphenoidale will eventually attach the vomer, the bone that creates the posterior part of the nasal septum, like so. Now, the lateral surfaces of the body are still endocranial, and they display this groove which we call sulcus caroticus, which holds the internal carotid artery. Now, the 2 wings, the lesser wing and the greater wing, attach to the sides of the body. The lesser wings attach by 2 roots to the anterior superior angle of the body, and between the 2 roots and the body we have the canalis opticus, a communication with the orbit. The lesser wings have a posterior free margin that ends in a protrusion which we call processus clinoideus anterior. Now, underneath the lesser wings, between them and the lesser wing and the greater wing, we have a fissure, fissura orbitalis superior, again for the communication with the orbit. The greater wing attaches to the side of the body from inferior and lateral, and it has 3 characteristic openings. One of them is the foramen rotundum, which is practically running horizontally in an anteroposterior direction from the internal surface of the skull to the exobase, to this area which we call the sphenomaxillary surface of the greater wing, and in fossa pterygopalatina. The second opening is a large opening oriented vertically. This is called foramen ovale, and this opens into the infratemporal surface, or onto the infratemporal surface of the sphenoid bone, inferiorly then. And behind it we have a second smaller opening which we call foramen spinosum, which opens again onto this infratemporal surface. Now, this greater wing, as mentioned before, has 5 surfaces. One of them is here, the facies cerebralis, and the rest are as follows. Externally, we have facies temporalis towards the temporal fossa, or the temporal region. Inferiorly, we will have the facies infratemporalis right here. The 2 surfaces are separated by crista infratemporalis from each other. On facies infratemporalis we have obviously foramen rotundum and foramen spinosum, as mentioned previously, and the posterior end of the greater wing here is protruding in a small spine which we call spina ossis sphenoidalis, which gives the name to foramen spinosum in fact. Now, The fourth surface is facies orbitalis, which creates the posterior part of the lateral wall of the orbit. And the last hidden surface is facies sphenomaxillaris, which, as mentioned, is inside fossa pterygopalatina and accepts the opening called foramen rotundum. The last part, again viewed from posterior, but this time this is outside the skull, are the pterygoid processes, processus pterygoideus. The pterygoid process is made up by two plates, lamina medialis and lamina lateralis. Between the two plates, we have the fossa pterygoidea, obviously. At the inferior end, between the inferior ends of the two plates, we have the incisura pterygoidea. And on the inferior extremity of the medial plate, we have a small hook-like structure we call humulus pterygoideus right there. Now, at the base of the pterygoid processes, we have a elongated groove, in fact a depression, which we call fossa scaphoidea. And the base of the pterygoid processes right here is crossed by an antero-posteriorly running tunnel, which we call canalis pterygoideus, which is not present on this model, of Vidius. So canalis pterygoideus of Vidius, which runs from posterior, like so, all the way onto the sphenomaxillary surface, exiting somewhere here below foramen rotundum. On the anterior side of the pterygoid process, we have sulcus pterygopalatinus or sulcus pterygoideus that is at the meeting point of the two plates.